Hi, everyone. Thank you all for joining us for the final installment of our summer education series, where we've been speaking with several of our closest partners who've helped us expand our services in response to COVID. I'm so pleased to introduce you to one of those partners, Tabitha Brewster. Tabitha is the CEO of Catholic Charities of Steuben and Livingston counties. She has a PhD in industrial and organizational psychology from Walden University, and brings her expertise to help streamline processes and procedures in her role as CEO. Tabitha is also very involved in several behavioral health committees geared towards Medicaid managed care and service provision. Thanks so much for joining us today, Tabitha.
Thank you. I'm so happy to be here. It's my pleasure.
Great to have you. So Catholic Charities of Steuben County provides multiple programs and services. Can you talk briefly about some of those programs and also your Turning Point program, which is the one that works most closely with the food bank?
Yeah, absolutely. So, Catholic Charities of Steuben is enormous. And as you had suggested, it's bigger than the state of Rhode Island. We serve over 20,000 people annually. Our services really range from prevention services focused on youth, as well as our kinship services, which we offer therapeutic foster care, and we offer parents education regarding parenting and any struggles that they may be facing. We offer residential services for adult males. So we have a community residence as well as some apartments throughout Steuben County, and we support the recovery efforts. But then, of course, you're right, we're here today to talk about Turning Point, which is really focused on meeting basic needs of people who are struggling. And really that consists of things like helping pay rent or a utility if electric has been shut off. But most importantly is meeting that basic need of food and getting food and those sorts of resources to people.
Yeah, definitely important stuff all around.
Sure.
Ooh. So you mentioned, yes, Steuben County, it's the largest county that we serve. It is, in fact, larger than my home state of Rhode Island. I always like to share with folks. But it's also very rural, which presents its own unique challenges. What were some of the challenges that your clients were facing pre-COVID, and how has the pandemic impacted their lives?
Well, pre-COVID, many folks that we served certainly struggled with things like transportation. Transportation is extremely difficult in rural communities. Being able to find a bus that would take their family to daycare, or to drop off children at daycare or get to a job, to get to any resources that they may need, such as services through Turning Point. So access to food. Being able to secure affordable and safe housing, job placement, all of those things were certainly a struggle pre-COVID. Mm-hmm. And then, of course, the impact just is, it's the breadth and depth of it from our, children that we serve to the elderly. It's one of those things that is a significant struggle to get folks what they need.
Mm-hmm. Yeah, and across our network, partner agencies saw a 50% increase in demand on average in both March and April, while at the same time having to modify their operations to keep their staff and their volunteers safe. Can you talk a little bit about what you saw at Turning Point during that time and share the impact that COVID-19 has had on your staff and your volunteer program?
Yeah, so, when COVID hit, obviously it took us all back. It was quite a shock. We weren't sure, how to really proceed. Initially, it was uncharted territory. We had to literally change our entire model, our entire way of doing business. And really what that means is prior, folks would come to us for those services, right? So brick and mortar. And then when COVID hit, we realized that those pre-COVID challenges were even more profound. Honestly, people had challenges to even find a bus that was running, and especially in rural counties. Really trying to keep people safe and meet their basic needs. During COVID, we had to switch our model to mobile delivery. In other words, we started to take services to people in their homes to make sure that those basic needs, such as food, were being met and people were not starving. And it was significant because we didn't necessarily have enough people to provide those services, and to be able to send those folks into the community to be able to help I think it was over 1,200 people just in a short amount of time. So taking food back and forth, and as you know, Steuben County is huge. So to get to one end of the county to the other and make sure people got what they needed was extremely difficult.
Yeah, and you guys also had to suspend your volunteer program, right?
We did. Temporarily, we did suspend our volunteer program, again, for concern that, we weren't sure, what COVID was about, and we didn't want to put those folks at risk. And so we really had to tap into other service areas, some of those other programs that we offer, to be able to have enough staff to deliver those resources.
Right. Yeah, challenging. Lots of people wear many hats anyway in the nonprofit world, and
Sure do.
COVID, it was double the hats.
Triple the hats.
Triple the hats, right. So as we look ahead, what concerns you most about the post-COVID future for both your organization, but also the people that you serve?
Well, I mean, honestly, first and foremost, when we look at the organization as a whole, resources are a big concern. Really making sure, honestly, Natasha, that we have enough to be able to serve people. And thankfully, we have like-minded agencies such as the food bank and others to be able to help us support those efforts. So resources is a big concern. Also, I think about staffing. We have families that are facing even more challenges when it comes to school systems and being able to work and provide home care when it's needed. And so we're really concerned about what that may look like in terms of staffing, if we're going to have enough folks or availability of people, while making sure that we're there to support them and help them through this difficult time. So it's certainly staffing that's a big concern, again, because they're the ones that really help us supply these services. Bringing back volunteers slowly, making sure everybody stays safe, and so those are some real challenges and concerns. The state budget, the uncertainty of cuts that I think we may end up facing collectively as nonprofits and across the board. And so those uncharted territories that we are about to face, that we are facing, but even more significantly into the future, is a real challenge for us to try to navigate.
Mm-hmm. Yeah, absolutely.
And then on the flip side, so in terms of the individuals that we serve, it's a lot of those same pre-COVID challenges that we know many of the people that, we work with faced. They're even more profound now. And, when things like, this housing stay in place order was lifted and folks were evicted, it's definitely posing a significant challenge for us, and we're we try to continue to meet those needs. And if somebody needs assistance with rent or whatever, in addition to food, it's something that we really rely on our community to help us meet those needs.
Yeah, yeah. It's definitely challenging. These are complex issues. They were complex before COVID, and they're going to continue to be complex.
Absolutely. Absolutely.
So now I do know the pandemic really pushed the food bank team to kind of take a look at our work in a different light and make some, real significant changes to the way we've always done things. For us, there have been a lot of positive learnings from this experience. So what changes have you implemented in Turning Point or at Turning Point that you're looking to continue into the future?
Well, really looking at that mobile model, taking services to people, really getting into the nitty-gritty of our most rural communities, making sure that they have the resources that they need. And so we're really trying to figure out how we can manage that and make sure that we're taking our mobile units into those pockets and regions. And quite honestly, making sure that, at the same time that we're trying to keep everybody safe. Significant challenges, and I know we keep repeating that, but it's honestly one of those things that is something that we're trying to find a healthy balance, right?
Yeah. Providing more services to people who really need the help, and also keeping your staff safe and sane, right?
And sane, yes.
Sane. Yeah.
So we're really focused, Natasha, on the mobile piece of things, and really trying to meet people and their needs where they're at.
That's great. That's excellent. So Tabitha, what is the best way for the community to support your work? Well,
Honestly, the best way to support our work is to really get involved. It's wonderful that we have such productive, like-minded folks that want to help people, right? And so we will eventually be bringing back volunteers. So volunteering is one way that people can get involved. Also, donations, things like monetary and food, making sure that we have enough resources, because as we previously stated, those are certainly significant challenges. So making sure we have enough to go around. And the other thing is being ambassadors for what we do. So we want people to be able to go into our communities and really have an idea of the services that are out there. And if they're not sure, call us. Give us a call. So making sure that they're able to sort of regurgitate the information and get it out there, and really be a voice for us and our services, so we can serve more people.
That's excellent. Well, thank you, Tabitha, for spending some time with us today. It's always great to chat with you.
Thank you.